Allergies, itchy eyes or skin, cold or sore throat, tummy trouble, aches and pains? Think pharmacy first. Your local pharmacy is your expert NHS health team treating a wide range of common illnesses and health concerns with no need to visit your GP. Remember, always keep a well-stocked medicine cabinet and order repeat prescriptions in plenty of time. Find your local pharmacy at nhs.uk/findapharmacy. NHS, here to help.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi, and welcome to the latest episode of the Providers Podcast. I'm your host, Harry Newhouse, Communications and PR Officer for the North East and North Cumbria Provider Collaborative. Today we're focusing on recruitment at the Medicines Manufacturing Centre. We'll be looking into how the organisation is building its workforce ahead of opening and the range of roles and opportunities that will be needed to support medicines manufacturing in the NHS. We'll also touch on the scientist training programme as one of the key routes into the centre. Ahead of production beginning, the Medicines Manufacturing Centre is laying the foundations for a highly skilled workforce that will play a crucial role in supplying medicines for patients across the NHS, while offering unique training and career opportunities in a highly regulated environment. Today I'm joined by Jody Varley, who is the Education and Training Lead, and Carly McGurty, who is the Deputy Head of Quality, both from the Medicines Manufacturing Centre here in Seaton Delaval. Welcome to you both and great to have you with us.
Hi, Harry.
Hi. So to start off, could you both introduce yourselves and tell us a bit about your roles at the Medicines Manufacturing Centre?
My name's Jody. I'm the Education and Training Lead. I'm responsible for the training department at the MMC, which is involved in delivery, recording and monitoring of training. So this involves identifying training needs of individuals, scheduling training, ensuring training records are up to date and ensuring that the training that we're delivering is actually effective. It's my responsibility as well to ensure that all of our training documents and records are in line with GMP requirements.
Hi there, I'm Carly. As Harry said, I'm the Deputy Head of Quality here at the MMC. My role involves overseeing the quality assurance, both the operations and the validation activities across the site. So we have two sides of the QA team. One of those is operations and one is validation. Both teams are very busy at the moment, so we've got the validation team working on getting in new equipment and qualifying that equipment ready for go live, and we've got the operation team that are working largely on developing our pharmaceutical quality system and procedures.
Brilliant. So for listeners who might not be familiar with it, what is the Medicines Manufacturing Centre and what will its role be once it becomes operational?
Yeah, so the Medicines Manufacturing Centre is a regional aseptics hub based in the northeast of England, and once we're operational we will provide sterile injectable medicines for patients across the region. We'll manufacture medicines such as antibiotics and chemotherapy, and it's really important that we manufacture these as sterile because the patients that we're delivering these to are immunocompromised, so really important that we're providing a really high quality medicine for them.
So the centre isn't open yet, but a lot of work is already underway. Why is it so important to start recruiting and developing the workforce at this stage?
Yeah, so there's a lot of work that goes into opening a facility like the Medicines Manufacturing Centre. So we need a lot of skilled workers here to help develop our policies and procedures, validate the facility and our equipment, and design all of our processes. So it's really important that we have enough time to train our workforce and give them the skills that they need to be able to work in the manufacturing environment before we go live. Before we start manufacturing medicines, we need to apply for our MHRA licence as well. And at that point we'll have an inspection, so that's one of our key objectives in this phase of the project. That's inspection readiness.
And what type of roles and skill sets will the centre need in place to be ready for production?
So we'll need a broad range of roles to be fully ready for production. So that's all roles from production operators all the way through to releasing officers, quality control scientists and even warehouse staff. So each of these roles plays a critical part in the overall process, from actually manufacturing the medicine to testing them, releasing them safely, ensuring that materials and products are managed efficiently. Alongside these roles, there's also some key skill sets that really underpin everything that we do. Attention to detail is absolutely vital. We're working in a highly regulated environment where accuracy and quality are critical. Good hand-eye coordination is important, particularly for manufacturing tasks, and also strong communication skills are really needed because we work across such a broad range of teams, so we need to be able to work seamlessly together as well.
Carly, from a quality perspective, how important is it to recruit people who understand or are willing to learn the standards and responsibilities that come with medicines manufacturing?
From a quality perspective, the people we bring into the organisation are really key. We can have the best facilities, the best equipment, beautifully written procedures, but if the people operating the systems don't understand the standards or aren't willing to learn them, then the whole thing comes a bit fragile very quickly. It's not just about the technical knowledge though. What we're really looking for is the core values and attitude of people. Do they understand the weight of the responsibility of the actions they're doing? Are they detail orientated? And do they feel comfortable speaking up if something doesn't look right? We're dealing with products that go directly into patients, often patients who are already quite poorly. So it means every action, every gowning step, every aseptic manipulation, every environmental monitoring activity, it really relies heavily on human behaviour. So recruiting individuals who either already understand GMP or good manufacturing practice, or who demonstrate the right mindset to be able to learn it and respect them, that's fundamental for our quality culture.
Brilliant. And you already have, like you mentioned in the introduction, that you already have some people already working for you, so...
We do, yes. We have a core team in post at the moment, and they're doing a great job of pulling that together, but also part of their role is to develop these training packs, and along with Jody's team, to grow that workforce as the site grows.
Jody, what role does education and training play in attracting people to the MMC, particularly those who may be early in their careers?
Yeah, so we are typically quite an unknown area of the NHS, although the work that we do still has a big impact on patients' lives. So it's really important that we kind of shout up about the amazing work that we do. In the last few months, the education training team have been attending careers events. So we visited schools, colleges, and we've even been part of a masterclass organised by Northumbria NHS Trust. So it's really important that we just make people aware of this area of the NHS and highlight just how many opportunities are available for school leavers, graduates, but also experienced people that are already in the industry. We also are supporting the development of our workforce by looking at offering apprenticeships, work experience, and we are also supporting the scientist training programme by hosting 2 trainees from September 2026.
So you touched on the scientist training programme there, and that's one way that you can learn your trade and work at the Medicines Manufacturing Centre. Can you briefly explain what the programme is and how it fits into the wider recruitment and workforce strategy?
Yeah, I can take that. So the STP is a national graduate programme. It's funded by NHS England. The STP, it offers multiple specialisms across healthcare science. So STP trainees we plan to host here at the MMC will train within the pharmaceutical science specialism. The programme lasts for 3 years, and trainees can work within a pharmaceutical manufacturing unit within the NHS, experience in rotations across production, radiopharmacy and aseptic services, whilst also studying a part-time master's degree. Trainees are supernumerary, which means they can really focus on developing their skill set and have a big focus on project work without being kind of pulled into the day-to-day rota systems. They're a key part of our workforce, so we're really passionate at the MMC about being able to develop the next generation of scientists, and that's why we're supporting 2 trainees this year. Due to the rotational nature of the programme, it gives STP trainees the opportunity to have exposure to all areas of technical services, and that allows them to then specialise in an area which aligns with their skills and interests and career goals. It also helps us as a workforce to build a resilient workforce that has skills in all areas of the organisation.
And am I right in thinking that you can talk from experience about the programme because you two...
I am, yes. It is a great scheme, so maybe slightly biased, but it is a very good training programme.
Yeah, how was your experience? So what did you go through, and how has it helped you get to the MMC?
Yeah, so I trained in the North East as well. So my experience was really positive of the training. We had, as I kind of mentioned, you've got exposure to lots of different areas of technical services, so it really allows you to see which bit excites you, see which bit is really aligning with your skill set. Obviously there's not a guaranteed job at the end of it, but it really puts you in a good position in terms of career opportunities for senior roles within the NHS.
Yeah, I think kind of following on from what Carly just said, it's a really good programme that gives you such a broad range of skills. So although jobs aren't sort of guaranteed at the end of it, you're put into a really strong position of when you do apply for a job, you've got the skills, the experience needed to really shine and show what you're capable of. So, yeah.
Was it a vital part of you two getting your roles here?
For me, yeah, 100%.
Yeah, I agree with that as well. I've spent quite a long time in the NHS now, and a small part of my early career was in pharmaceutical industry, but absolutely has helped that the training programme, it doesn't just develop your technical ability and your technical skills, you also learn NHS frameworks and how the NHS functions as a service, and I think that's really key. And it's also really sort of a passion of mine to be that step closer to the patient as well.
So how does the programme help build sustainable pipeline of talent for the centre over the long term?
So the programme runs annually, so every year there's an opportunity to sort of bring trainees in. At the MMC we are planning to host SCP trainees every other year, but that will help us create a consistent and predictable flow of talent into the MMC. So by bringing trainees in on a regular cycle, we're not just relying on ad hoc recruitment, but instead we're building a structured pipeline of people who are already familiar with our facilities, processes and culture. During their time with us, as we've mentioned, trainees will gain hands-on experience in a real manufacturing environment. They'll be able to develop specialist skills, build relationships across multidisciplinary teams. And like we said, that does mean that when permanent roles do become available, we've got a pool of highly capable candidates who aren't only technically trained, but are also already embedded in how we operate. In the longer term, this approach helps us to support workforce sustainability by reducing recruitment gaps, improves retention, and it also helps us to grow our own talent as well. It ensures that we can adapt to future demands in medicines manufacturing by continuously developing individuals with the right skills and mindset to be able to innovate and evolve with the sector as well.
Speaking more broadly, what qualities or attributes are you looking for in people who will succeed in this environment beyond technical skills?
We're looking for people who have a keen interest in contributing to patients and their safety. Someone who has good organisational skills and can manage their workload effectively. We pride ourselves at the MMC on having a positive no blame work culture, so someone who can also contribute to this. More broadly, we're also looking for people who are adaptable, able to follow strict procedures and committed to maintaining high standards. It's very much a team effort, and success depends on individuals understanding not just their own role, but how they contribute to the wider manufacturing process and the NHS as a whole.
So we've talked about people coming in here, starting their careers. So how does the centre work to ensure it offers long-term careers here, not just jobs for people to join?
Yeah, so at the MMC we are building a positive work culture. We're building our connections as a whole team, and we're trying to recognise the entire person, not just the part of the person that comes to work every day. So far we've got involved in fundraising for charity, so we took part in Movember, and we've gone on staff socials, and we've also focused on doing team building activities every month. We also invested in people's personal development, and we recognise how important continuous professional development is. So we are encouraging members of the team to think about their long-term career goals, as well as focusing on the here and now, but also how can we help them to get there. So it's a real priority, making sure that people get the opportunities that they need to develop their skills as well as we move on.
Finally, what would you say to someone who's considering applying for a role at the MMC or is interested in being part of its future workforce?
Yeah, it's an exciting time to join the MMC, a real opportunity to put your stamp on something new. So it's going to provide so much benefit to the region as well as our patients. Upcoming jobs and vacancies, just really keep an eye on the NHS Jobs website as well as LinkedIn. Also feel free to connect with us and keep up to date so you can really see as soon as we post those vacancies. NHS recruitment can be a tricky one to navigate if you're not familiar with it, so when you do find that job that you're interested in applying for, just make sure you get across in your application exactly demonstrate how your skill set meets what we've set out in the job description, because it really makes you stand out in that shortlisting process.
So just to add to what Carly said as well, what we're building at the MMC is really a once in a career opportunity for a lot of us. So it's really exciting, and we have that opportunity to make a difference and lead the way in medicines manufacturing and how we can develop it in the future.
Has recruitment started already, or when will it start?
Yeah, so we do have a workforce already of about 32 people. But when we're fully operational, we have a headcount of around about 140. So as you can imagine, there's still quite a lot of recruitment to happen yet. There will be quite a significant ramp up in the coming months towards the end of the year and into next year. So as I say, please keep your eye open on the LinkedIn and any updates that we've got of when recruitment starts again. In the meantime, feel free to reach out to let us know of your interest.
That's brilliant, Carly, and all the jobs will be posted, like you've mentioned, on the Provider Collaborative LinkedIn, and I'm sure we'll have lots of recruitment events going on in the near future. So that's been really insightful. Thank you both. That brings us to the end of this episode. So thanks for listening, and we'll see you next time on the Providers Podcast.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.